Taking supplements has become a very big deal, at least in Los Angeles. It's a very popular thing to talk about, and people, I think, are really confused by it. I often have people come in to see me with bags or totes of supplements that they want to go through to see what they should or shouldn't be taking, and they're often taking things because they read about it. It's very rare that it's been recommended by any kind of doctor. Supplements are exactly what they sound like. They're meant to supplement. So you really only need them as a general rule if you're trying to make up for a depleted body or system. So our food system is very depleted because of the way we've been growing our food, the way our agriculture is. So a lot of the nutrition that we're getting isn't really quite as good as it could be. So I think as a rule, a lot of us probably are lacking in certain vitamins and minerals. One of the supplements that people take and should be more cautious about and take it because they feel like everyone should take it is vitamin D. And vitamin D in higher doses can be very toxic, and not everyone needs it, and it needs to be tested through the blood to know if you're low or not. I often see low D as a byproduct of anxiety and depression, so you will see symptoms of low vitamin D. The other mineral that a lot of people are low in is magnesium. Tends to be depleted, but again, like that could cause diarrhea if you take too much of it. So it really should come with a recommendation from a doctor or a nutritionist, or even hopefully a psychologist that knows about these things, because there are also, we have to think about the timing of when you're taking a vitamin. We have to think about the cofactors that go with that vitamin. So for example, calcium and magnesium need to be taken together. So it's really about dosage, and I think we need to be taking our supplements a little bit more seriously than we are in our current culture, and that they shouldn't be so blatantly used in the way that they are. I recommend supplements for mental health that are pretty specific. Honestly, I almost always will recommend a probiotic just because of the gut-brain connection, and a lot of people do have compromised digestion and gut health, so that's kind of a go-to for me. Also, magnesium would be something that I would almost always recommend for people. The more interesting supplements that I've been dabbling in, and that I think a lot of people aren't as aware of, are what we call our amino acids. And the amino acids are really important because they're the building blocks of our neurotransmitters. So when you eat protein, for example, and you digest it, that goes into the blood as an amino acid. And that helps stabilize our mood, it helps our brain function well. And so we can still supplement with some of these amino acids to help people with their mood. Some of those would include things like L-tyrosine, 5-HTP. Another one that I often recommend is L-glutamine. L-glutamine is really helpful for the gut, but it also balances blood sugar, because blood sugar is another big issue with mood. So those are probably some of the ones that I would go to. Also, another important vitamin, or multiple vitamins that people need to be taking when it comes to mental health, are a B complex, a really good B complex vitamin, because the B vitamins are the cofactors also for all of those neurotransmitters in a lot of our systems. So those are examples of supplements that actually work in a varied way. It's not just about supplementing depletion, but also like helping the body work to its full capacity, and the brain. Well, if somebody came in with really severe anxiety, the first thing I would do is assess them with a specific assessment that looks at all of their neurotransmitter functioning, and I ask really specific questions based on their mood. It's also kind of assesses what they're using to mitigate that mood. So it's an assessment that lists symptoms, and then on another column it will have things like coffee or chocolate, or things that they're using to kind of calm themselves down, or even speed themselves up sometimes. But if somebody came with really severe anxiety, the first thing I would want to know is the anxiety manifesting more in their thinking? Is it obsessive thinking? Is it more in their mind? Are they ruminating? Or is that anxiety are they feeling it more in their body, like almost like as a wired and tired kind of experience? More panic ridden. So that would determine what I would recommend. If it was more of a kind of ruminating thought, and they were more in a worry state, and the anxiety, they felt like they couldn't stop their thinking, that I would lean more towards something like 5-HTP, which would boost their serotonin levels. If it was something that was maybe a little of both or more in the body, then I might think about GABA, which is another amino acid that helps calm the body, and it's the kind of puts on the brakes to its counterpart glutamate. And so by balancing that system, you can calm them down physically, which in essence will reduce their symptoms of anxiety. Again, I would think about a B vitamin. I would also think about the probiotic, and then I would ultimately also think about fish oil, omega-3 fatty acids, which can be really helpful with any kind of mood disorder.